Alright, this is Pack 365, myself Srija. So today in this session we are going to learn about the ICD-10-CM coding classification for the disease of ear and mastoid process. So what is ICD-10-CM? We are discussing in each and every anatomy of the body system about the ICD-10-CM. So this is a standardized international system which is used to code diseases, disorders, injuries and clinical symptoms. So this is essential for the medical documentation, billing and reimbursement, epidemiology and also the public health. So this code range H60 to H95, this specifically covers the diseases related to ear and mastoid process. So why this category is important? Because the ear is not only important for hearing but also for balance, communication and also the spatial orientation. So because the ear has three major parts like external ear, inner ear and also the mastoid process. So what is the purpose of H60 to H95 codes? So these codes, they help the clinicians to document the correct diagnosis. So coders to assign the accurate codes for billing and students understand the disease classification and researchers that track the ear related health statistics. So these codes are arranged based upon the anatomical location like external ear, middle ear, mastoid, inner ear and also about the auditory and vestibular nerves. It is also arranged based upon the type of disease, whether they are the infections like otitis externa and otitis media, inflammation, injuries, or mixed hearing losses or connecting hearing losses, etc. So, what are the categories of the diseases of ear and mastoid process? So, H60 to H62. So, they cover the disorders of external ear. Like these include the conditions such as the otitis externa, impacted cerumen, chondritis, etc. So, these codes mainly focus on the problems outside the tympanic membrane. So, next codes is H65 to H75. So, this cover about the middle ear and mastoid disorders. So, they cover otitis media, tympanic membrane perforation and also the other disorders like tympanosclerosis, adhesions, etc. So, middle ear disorders often affect the hearing through the conductive mechanisms. And then is H80 to H83. So, they cover the disorders of the inner ear. Like they include vertigo, BPPV and also labyrinthus-like disorders. Whereas H90 to H95 category, they include the disorders involving the hearing loss, tinnitus and also the other ear disorders like conductive hearing loss, sensory neural hearing loss. So this is based upon the anatomical location and type of the infection. So now let's go into the code classification briefly. So H60 to H62. So this category, they involve the diseases affecting the external ear, which includes the auricle and also the external auditory canal, which the ear canal up to the tympanic membrane. So conditions in this range, they usually involve the inflammation, infection, trauma, dermatological issues, abscesses, cellulitis and perichondritis. So H60. So H60, what is H60? It is otitis externa, which is nothing but the external ear inflammation. So otitis externa, it refers to the inflammation or infection of the external auditory canal, which is also called as pinna. So what are the common causes of the otitis externa? Moisture in the ear, which is called as the swimmer's ear. Trauma from using the earbuds, cotton swabs and also hearing aids. So what will be the symptoms? You can see the ear pain, especially whenever touching the ear, itching, swelling of the ear canal, redness, pus discharge and also the temporary hearing loss due to the swollen canal. So what is the subcode of H60? H60.0, which is the abscess of external ear. So what do you mean by abscess? Abscess is a localized collection of pus which is caused by the bacterial infection. So what is a clinical example? A boil inside the ear canal after scratching. So if the abscess is part of a generalized infection like cellulitis, you have to use H60.0 unless the documentation states otherwise. And there is also the other subcode called as H60.1, which describes the cellulitis of the external ear. So cellulitis is nothing but it's a diffuse skin infection which is spreading through the deeper layers of the skin. So what is the example? The infected earlobe after ear piercing. So next is H61 code. This describes, and in this category, it includes the non-otitis conditions affecting the external ear. What is the subcode? H61.0. So which is perichondritis of the external ear. So this category, what do you mean by perichondritis? It's an infection of the perichondrium layer, the connective tissue surrounding the ear cartilage. So why it's serious? Because the ear's cartilage has a poor blood supply. So infection can spread quickly and lead to the deformity. So what is an example? Perichondritis after a traumatic ear injury. For example, blow to the ear, wrestling injury, and also the contaminated piercing. So how do you differentiate between cellulitis and perichondritis? So cellulitis, it involves skin, whereas perichondritis, it involves the cartilage, which is accurate coding depends on what structure is involved. So in the right side, the image shows a swollen or inflamed external ear with raised or tender tissue. So this is consistent with the abscess of the external ear or severe perichondritis or cellulitis after the trauma or piercing. So next is H61.2. So what it is? Impacted cerumen, earwax. So impacted cerumen, it occurs when the earwax becomes tightly packed in the ear canal and it cannot be removed naturally. So why this happen? Because of the overuse of the cotton swabs, which pushes the wax deeper, narrow ear canals, uses of the hearing aids or earbuds, excessive wax production. So what will be the symptoms of the impacted cerumen? Decreased hearing, ear fullness, erect and tinnitus like ringing. So what is the coding tip? You have to use H61.2 only when the cerumen is impacted. So ordinary wax that is not obstructive should not be coded here. Okay. So here is a picture which shows you the ear canal blocked with the hard cerumen. So this is the ear wax, right? So wax pressing against the tympanic membrane. This visual reinforces how impacted wax prevents proper diagnosis of the ear conditions. So next category is H62, which describes about the external ear disorders in diseases classified elsewhere. So this is used whenever the external ear is affected as a secondary manifestation of another systemic disease, but not as a primary ear disorder. So these codes, they are secondary codes and must be paired with the primary disease code. For example, TB syphilis. So there are some examples like TB otitis externa. So this is a mycobacterium tuberculosis infecting the external ear. So the primary code is TB code, the tuberculosis code, whereas secondary code, it involves the H62 category. So the other example is syphilitic lesions of ear. So this is a secondary manifestation of the syphilis infection. So the primary code is, you have to assign A52, A53 category codes. And the secondary code is, you have to include H60 category code. So next coming to H65 to H75 code categories. So these codes, they describe the diseases of the middle ear, behind the eardrum, and also about the mastoid process, which is a air-filled bone behind the ear. So the first code is H65, which involves the non-suppurative or non-pus otitis media. So what is otitis media? The inflammation of the middle ear without pus or active bacterial infection. So what are the causes of this non-suppurative otitis media? Allergies are the most common one. Eustachian tube dysfunction, viral infections, barotrauma, and the key features of this non-suppurative otitis media are, you can see the fluid build-upping behind the eardrum. So there will be no pus, no acute bacterial infection, and also it is often chronic or recurrent. So you can feel the feeling of fullness and ear popping and a mild discomfort within the ear. So these are the symptoms of the non-suppurative otitis media. So next is acute serious otitis media. We have to assign code H65.0. So this is based upon the type, duration, cause and presence of the fluid or suppression. So H65, this category, it includes the serious secretory or mucoid otitis media. So this usually involves about the fluid behind the tympanic membrane but not the pus. So H65.0 category code, it involves the acute serous otitis media. Serous means it's a thin watery fluid. So this often occurs after the upper respiratory infection, allergies or eustachian tube dysfunction. So what is the example? A child develops a serous otitis media after having a cold. So you have to assign the code H65.0 for in this case. So there is also the other subcode H65.2 which describes the chronic serous otitis media. This is a long-standing fluid in the middle ear. It is often called as a glue ear and especially in the children. So for the example, the child with the persistent middle ear effusion for months. So what are the images related over here? Serous otitis media, which is a thin and yellowish fluid which is showing in this picture, and the secretory otitis media, which is a thicker fluid mucus like media. So this is about the H65 category code. And then coming to H66 category code. So this refers to the bacterial infections producing pus in the middle ear, nothing but the suppurative otitis media. And this A65 is non-pus forming and H66 is about the pus forming otitis media. So what is H66.0? Acute suppurative otitis media. This is a rapid onset of the otitis media. What will be the symptoms? You can see the ear pain, fever, purulent discharge if the tympanic membrane ruptures. So the example is child with fever and the pus filled middle ear after the URI. So whenever acute suppurative otitis media is diagnosed in the patient record, you have to assign code H66.0. So what is H66.1? It is chronic suppurative otitis media. So chronic means it's a long-term disease. So it's a persistent or recurrent infection. So this may involve the TM, perforation or cholesteatoma. So this can lead to complications like hearing loss, mastoiditis and also the tympanic membrane retraction. So images related to this suppurative otitis media are acute otitis media, which is a red bulging tympanic membrane shown in this picture, and chronic otitis media without cholesteatoma, which is an ongoing discharge thickened TM, and TM retraction, which is inward pulling of the tympanic membrane, and the last one is chronic otitis media with the cholesteatoma. This is a skin debris mass in the middle ear. So this is about the suppurative and non-suppurative otitis media. So H61 is otitis media in disease classified elsewhere. So this category is used whenever otitis media is caused by an underlying systemic disease. So you must code the primary disease first, then you have to code the H67 code. What will be the examples? Tuberculosis otitis media, which is associated with the tuberculosis infection, and then syphilitic otitis media. This is due to a congenital or acquired syphilis. Measles related otitis media. So this is a measles virus causes a middle ear inflammation. So when to use H61? When the disease responsible is outside the range of H60 to H95. So you have to never use H67 as a standalone primary code. You just remember this point. Okay. So next is H68 category code. So this describes about the eustachian tube disorders. So what is eustachian tube? It is a tube which connects the middle ear to the nasopharynx. So what are the functions of eustachian tube? It pressures the equalization, it involves the ventilation of the middle ear, and it also helps in the drainage of secretions. So whenever eustachian tube fails to function, so this can cause the otitis media, hearing issues or the chronic middle ear fluid. So coming to H68 code, it is eustachian tube salpingitis. So what is the meaning? Inflammation of the mucosal lining of the eustachian tube. So what will be common causes? The viral infection, allergic rhinitis, and also like upper respiratory function. So you have to assign the code H68.0 for eustachian tube salpingitis. So next code is H68.1 for obstruction of the eustachian tube. So this is a complete or partial blockage of the eustachian tube. So what will be the example? Adenoid hypertrophy causing eustachian tube obstruction. So this leads to the chronic secretory otitis media within the child. So H69 category code is for other eustachian tube disorders. So this category code, it is used whenever the ET tube disorder does not fit the specific H68 categories. So H68.8 for other specified eustachian tube disorders. For example, ET dysfunction due to allergies, temporomandibular joint related ET issues, and also patulous ET over the open tube. So what is the main tip for coding over here? You have to use H69.8 code when the provider documents a specific ET condition but does not label it as a salpingitis or the obstruction. So this is about H69 code. So next is H70. So this is about mastoiditis and also the related conditions. So the mastoid bone, it contains air cells that connect with the middle ear. So when the infection spreads from the middle ear, the mastoiditis, it can develop. So what are the subcodes? H70.0 for acute mastoiditis, whereas H70.1 for chronic mastoiditis. So acute mastoiditis is nothing but it is a serious complication of untreated or severe otitis media. So the clinical features are fever, pain and swelling behind the ear, redness over the mastoid area, and also ear discharge, narrowing of the auditory canal. For example, the child with high fever and swelling behind the ear after the otitis media. So what will be the complications? Like meningitis, epidural or subdural abscess, facial nerve palsy, hearing loss, etc. So next is H70.1 for chronic mastoiditis. So this is a long-standing one. Chronic means nothing but it's a long-standing infection or inflammation of the mastoid air cells. So what will be the signs? Persistent otorrhea, hearing loss, and sclerotic mastoid on imaging. So this is often associated with the chronic suppurative otitis media. So the right side you can clearly see about the acute mastoiditis. You can see the clinical features. How do you manage this infection? And also there are the complications of this mastoiditis infection like meningitis, facial nerve palsy, hearing loss, osteomyelitis, and labyrinthitis. So this is about H70 code category. So next is H71, which is a cholesteatoma of a middle ear. So what is a cholesteatoma? It is an abnormal keratinizing squamous epithelial mass that grows inside the middle ear. It is not a tumor, but it behaves aggressively because why it is dangerous? It expands and traps the keratin. It causes the bone erosion. It leads to the hearing loss, dizziness, and facial nerve weakness. So it also can spread into the mastoid, resulting in the mastoiditis. So severe cases can cause the intracranial infections. So this makes it a very important ENT diagnosis. So what is subcodes? H71.0. It is cholesteatoma of attic, which is a pars flaccida. So attic is the epitympanum layer, which is the upper part of the middle ear. So pars flaccida, it is the most common site for primary acquired cholesteatoma. So what is the typical cause of this cholesteatoma? It's a refraction pocket of pars flaccida due to ET dysfunction. So H71.2 category is cholesteatoma of pars tensa. So pars tensa is the larger and stiffer part of the eardrum, right? So cholesteatoma here is often due to the TM perforation and infection. So next subcode is H72. H72, it describes about the perforation of the tympanic membrane. So a tear or hole in the eardrum caused by infections or trauma and also like sudden pressure changes. So what is the subcode? H72.0 for central perforation. So what do you mean by central perforation? It is a perforation in the middle of the eardrum surrounded by intact rim of the membrane. So this is usually due to chronic otitis media. So what are the clinical notes of the central perforation? The most common type is that does not involve the margins of the eardrum and lower risk of cholesteatoma than the marginal perforations. So next is H72.1 attic perforation. So a perforation in the upper part which is called as the pars flaccida, right? So these attic perforations, these are highly associated with the cholesteatoma because keratin can accumulate through the attic defect. So the right side you can see the picture of the tympanic membrane which is perforated, and this is the normal tympanic membrane, this is a perforated tympanic membrane. So the normal one, the TM is healthy, translucent and pearl grey color. So it visible, you can see the visible malleus, umbo and cone of the light. Whereas in perforated tympanic membrane, you can see a visible hole or defect in this. So it has the irregular edges. So this may show the middle ear structures behind it. So signs of the infection, they may be present because of the redness or discharge. So next is H73 code category, which describes about the other disorders of the tympanic membrane. So you have to use H73 when a tympanic membrane disorder is documented but it is not perforation or not otitis media. So what are the examples of this H73? Meningitis, which is an inflammation of TM without the middle ear infection, atrophy, which is thin flaccid eardrum, and tympanosclerosis, where white calcified plaques caused by the repeated infections of ear tube insertion. So if TM looks abnormal but intact, you have to assign the code H73. So next is H74, other disorders of middle ear and mastoid. So this category, it includes the structural and chronic changes which are not the infections. For example, adhesive otitis media. So what is adhesive otitis media? The TM becomes retracted and also stuck to the middle ear structures. So this is caused by the chronic eustachian tube dysfunction. So this can lead to the ossicle erosion and also the hearing loss. So next category is H75, the middle ear and mastoid disorders in the disease elsewhere. So what does in diseases elsewhere mean? So this ICD-10 rule applies when the middle ear disease is not primary, but it is a direct result of the another systemic condition. So in such cases, you should not code the ear disease as primary. Instead, you have to code the systemic disease first, then add the H75 code as the secondary code. So this follows the ICD-10 instruction of code first the underlying disease. So when do we use H75? You have to use H75 when middle ear inflammation, middle ear effusion and also mastoiditis. So mastoiditis, these are caused secondary to the another major disease not due to typical ENT causes. So what are the examples of systemic diseases causing middle ear disorders? Syphilis. So the syphilis, it can cause the syphilitic otitis media, sensorineural hearing loss, tinnitus and labyrinthitis. Whereas tuberculosis, this can infect the middle ear and also the mastoid bone. So this can often produce the chronic ear discharge, granulomatous tissue and also the ossicular erosion. So patients may present with non-healing chronic otitis media with the pale granulation tissue. So coding example is, the primary code is A18.0 for tuberculosis of bones or joints including the mastoid, and secondary code you have to assign is H75. And third example is autoimmune diseases. So autoimmune disorders, these can cause the immune mediated inflammation of the middle ear and also the mastoid. For example, granulomatosis with polyangiitis, so which causes the chronic otitis media, mastoiditis and also the conductive or mixed hearing loss. So why H75 is important for coders? Because it shows the ear condition is a manifestation of another systemic disease. So this impacts the billing, treatment pathway and also the insurance. So this ensures the correct sequencing to always code a systemic disease first. So in the middle ear condition occurs because of an infection or allergy. You should not use H75. So H75 is only for the conditions that occur because of the diseases outside the ear. Right. So this is about the H75 code category description. So this is for today's session. I hope this session has helped you. So in the next session, you will be going to learn about the continuation of the ICD-10 code classification for the diseases of ear and mastoid process. So thank you.